Cervical cancer, causes and risk factors. You need to know. When we talk about cervical cancer, many people immediately think of it as something that just happens, or as a disease that arrives suddenly without warning. But the truth is, like most types of cancer, cervical cancer does not appear overnight. It develops over many years, beginning with small, silent changes in the cells of the cervix. And behind those changes are causes and risk factors that are often overlooked in daily life. Understanding these causes is the first and most important step in prevention. So let's go deeper. What really causes cervical cancer? Why do some women develop it while others don't, even when they live in the same environment? And what can women do to reduce their risk? The number one and most well-known cause is HPV infection, the human papillomavirus. This virus is transmitted mainly through sexual contact. More than 80% of sexually active women will be exposed to HPV at some point in their lives. Most of the time, the immune system clears it naturally. But sometimes the virus stays in the cervix and begins to damage the DNA of cervical cells. Over time, this damage can lead to precancerous lesions and eventually cervical cancer. Among the more than 100 HPV types, only a few are high risk. HPV 16 and 18 alone account for about 70% of cervical cancers worldwide. That is why doctors keep emphasizing the importance of HPV testing and vaccination. It is not about eliminating the virus completely, but reducing the chance of chronic infection. But HPV alone is not the full story. There are risk factors that make HPV infection more dangerous, or that weaken the body's ability to fight it off. One of the biggest risk factors is early sexual activity and multiple sexual partners. Starting sexual activity at a young age, when cervical cells are still immature, increases the risk of persistent HPV infection. Having multiple partners, or being with a partner who has had many previous partners, also increases exposure. This is not about judging lifestyle choices. It is about recognizing that certain patterns of sexual behavior carry a biological risk. Another major factor is smoking. Many people do not realize how strongly smoking is linked to cervical cancer. The toxins in tobacco don't just affect the lungs. They circulate in the bloodstream and can be found in cervical mucus. These chemicals damage the DNA of cervical cells and weaken local immunity, making it harder for the body to clear HPV. Studies show that women who smoke are about twice as likely to develop cervical cancer as non-smokers. Even passive smoking increases risk. Then comes weakened immune system. Women living with HIV, for example, or those taking long-term immunosuppressive drugs, are at significantly higher risk. A healthy immune system often keeps HPV in check, but when immunity is compromised, the virus lingers, multiplies, and has more time to cause cellular damage. Long-term use of oral contraceptives is another interesting factor. Research suggests that women who take birth control pills for more than 5 years may have a slightly higher risk of cervical cancer. The hormones in the pills can alter cervical cells, making them more vulnerable to HPV. This does not mean women should stop using birth control. It means that long-term users should be extra consistent with screening. We should also talk about multiple pregnancies and childbirth. Women who have given birth to 3 or more children are at increased risk. Pregnancy changes the cervix, and frequent childbearing may make cervical tissue more susceptible to HPV. The hormonal changes of pregnancy also play a role in creating a favorable environment for cancer development. Poor diet and nutrition deficiencies add another layer of risk. A diet low in fruits, vegetables, and antioxidants means less protection for the body against DNA damage. Folate deficiency, in particular, has been linked to higher risk of cervical abnormalities. When women lack these protective nutrients, the progression from HPV infection to cancer is faster. Socioeconomic factors are equally important. Women with limited access to healthcare, especially those who cannot afford regular pap smears or HPV testing, are more likely to be diagnosed at later stages. Cervical cancer is one of the clearest examples of health inequality. In countries where screening is widespread, rates are much lower. In areas with poor access, it remains one of the leading causes of cancer death among women. And finally, There are genetic factors. Some women are simply more genetically predisposed to developing cancer when exposed to HPV. Their immune response may not be as strong, or their cervical cells may be more sensitive to DNA damage. While we cannot change our genes, knowing family history helps in staying vigilant. So, to summarize, cervical cancer is mainly caused by HPV infection, but its development depends on a network of risk factors: lifestyle choices, immune system strength, reproductive history, diet, smoking habits, and access to healthcare. Now, why is it so important to know all this? Because understanding the causes empowers women to act. HPV vaccination, safe sexual practices, quitting smoking, eating a nutrient-rich diet, getting regular pap smears. These are not abstract recommendations. They are concrete ways to cut risk dramatically. A woman who never smokes, eats well, gets vaccinated, and screens regularly reduces her chances of cervical cancer more than tenfold compared to someone who ignores these steps. Knowledge is prevention, and prevention is always more powerful than treatment.